Hello, good morning, good evening to all of you. I know we have people joining us both here in the US as well as in India and South Asia. Welcome to all of you. Welcome to our discussion, Beyond the Haze, Interdisciplinary Perspectives on Air Pollution. I'm Hitesh Hathi. I'm the head of the Mittal Institute. The Mittal Institute has the mission of connecting Harvard University to India and South Asia. We do a wide variety of research in the arts, the humanities, in medicine. And these days, especially, we're focused on climate change. We convened India 2047, a very large gathering on climate change under the title of Building a Climate Resilient Future for the Region. It was a dialogue that brought together leaders in climate science, health, labor, business, and urban planning. The idea is to chart a path towards a sustainable and equitable future for the region as well as the world. And as all of you know, and the reason you're joining us, air pollution remains one of the most urgent environmental public health challenges in many parts of the world, and certainly at this moment in South Asia. I was just in Delhi, and I can testify to the urgency of the problem there. It affects millions. It's a hazardous condition in the winter, especially, uh, and it's now persisted for many years. So, how do we address it? It's a crisis. It's been a slow rolling crisis, but it requires science. It also requires historical context, social understanding, approaches to governance. So today's session brings together leading voices in medicine, public health policy, and environmental history to reframe air pollution through an interdisciplinary lens. I am just here to introduce this event. I want to turn it over to a very old friend and a colleague, in fact, someone I've known since the early 90s. He's a testament to human resilience in the face of adversity because I was actually officially one of his tutors, and he's risen far beyond that disadvantage to let me tell you his extraordinary achievements. David Jones, whom you see on the screen, he's the Ackerman Professor of the Culture of Medicine at Harvard University. His training has been in psychiatry and the history of science. His research has focused on the causes and the meanings of health inequalities and the history of decision making in cardiac therapeutics. Currently, David is working on two projects in India: a history of heart disease and cardiac therapeutics in the country, and a history of the threat of air pollution to health in India. His teaching at Harvard College and Harvard Medical School explores the history of medicine, medical ethics, and social medicine. And David, it's a pleasure and an honor to turn this over to you. To our listeners, again, for those of you who are just joining, thank you. We are about to begin. Please put your questions in the Q&A section. I will go off camera now so that the attention can be on the speakers and the content, but I will be here. David?
Okay, thank you, Hitesh, for the introduction. Let me just make sure I have my slides shared properly. Okay, that should be looking good. So again, thank you to Hitesh and for the staff of the South Asia Institute for setting up this event. I will make some brief introductory remarks and then introduce my colleagues who will share their thoughts. And then we will open up the floor for discussion and then for questions from the audience. So if you have questions, please do put them in the chat. We will keep an eye on that and do our best to answer all of them. Now, people often complain that historians always say the same thing. Whatever happens, we simply say, we've seen this all before, there's nothing new under the sun. And I'm certainly guilty of doing that many times. But for the topic we're discussing today, air pollution in India, I really do believe that history offers valuable insight. And I hope that we can demonstrate that this evening. As you all know, air pollution is a serious problem in Delhi and in many other Indian cities, especially this time of year. For the past decade, the problem has been so bad that it receives international media attention every winter. For instance, this article was just published in the New York Times this past Sunday, talking about both the severity of the air pollution and also various efforts that the government might be pursuing to reduce the reported air pollution levels. Many people in India think that air pollution is a new concern, something that has emerged only over the past 20 years or so. But India's struggle with air pollution goes back almost 200 years. Now, it is certainly the case that the situation is very different now than it was 50 years ago or 100 years ago, but there is still much that can be learned from this history. The most important message from the history is that change and improvement is possible if people are willing to do the work that it requires. Air pollution first became a major cause of concern in Calcutta and then Bombay in the 1860s, soon after the arrival of textile mills and coal-powered industrialization in India. Indian newspapers frequently published complaints about their factories and the impact on air quality. Lawsuits against factories were also common, filed either by city officials or by the factory's long-suffering neighbors. But in most cases, the mill owners were either acquitted or given trivial fines. Now, the owners complained that it would be too expensive to prevent smoke from their furnaces, and they threatened to relocate outside of Bombay or Calcutta if either city imposed serious regulations. City leaders were reluctant to do anything that would harm economic growth, and they generally let the smoke continue. Complaints finally reached a breaking point in the early 1900s. Calcutta and then Bombay passed new smoke nuisance acts that created commissions to monitor the problem. The laws also made it easier to prosecute factories that emitted excessive smoke. The new regulations had an impact in a remarkably short period of time, if you're willing to accept the data. Air pollution in Calcutta plummeted in the first year after the law went into effect, and then continued to increase for decades, and you can see the numbers there. In Bombay, there was a dramatic improvement within the first month of the Smoke Nuisance Commission coming online. It's hard to understand how this could have happened so quickly, and I'm a bit skeptical of some of the data, but there's no doubt that the commissions achieved dramatic reductions in factory smoke during their first decade. It turns out that it actually wasn't that hard or that expensive for factories to make the needed changes to bring their smoke under at least partial control. And concern about air pollution also motivated the search for new sources of electricity. In the 1890s, people throughout India began to explore the potential for hydroelectric power, especially in Bombay. The Tata Hydroelectric Project, proposed in 1906, began delivering power in 1915. It promised to reduce smoke and improve health in India, and it almost certainly did have the effect of contributing to the reductions of factory smoke from the textile mills in that city. Now, these kinds of efforts to intervene against the smoke and have an effect have continued throughout the 20th century. There are many cases of successes. One of the most successful efforts was the campaign to abolish diesel buses in Delhi in the 1990s. And there are ongoing efforts throughout the country to provide cooking stoves that burn cleaner fuels and do other things that might improve air quality. And so these cases demonstrate a basic point that the change is possible. Cities are able to reduce their air pollution. But then this raises the basic question: why does air pollution persist as such a dire problem in Delhi and in many other cities around the world? Now, there are many answers to this question. One problem has been that industrialization and economic growth have continued even as the smoke nuisance commissions tried to control smoke. Hundreds of new factories opened in Calcutta and Bombay between 1860 and 1940. Even if the average smoke from each individual factory decreased over time, the total amount of smoke emitted in the city still remains substantial. And this only intensified after India achieved independence and set out on a massive program of industrial expansion. The second problem is that sources of air pollution have continued to change. When the smoke nuisance commissions began their work in the early 1900s, they were concerned about factory smoke and then household smoke, for instance, from heating and cooking fires. But by the late 20th century, there were many new sources of air pollution. Some were new kinds of industries, including oil refineries, chemical plants, and electrical power generation. The transportation sector has also become a major source of air pollution, initially with railroads, but now with buses, trucks, and automobiles that have been proliferating quickly throughout India. And there is also a significant pollution problem from agricultural fires, from construction, and from many other sources. Air pollution is now a much more complex and a much more difficult problem than it was a century ago. This forces control programs in cities or states or the national government to try to pursue a moving target, something that would be hard to do in the best of circumstances. In India, the challenge is also often made worse by the decentralized governments and fragmented jurisdiction, especially in a city like Delhi. Another problem, a third problem, is that many pollution control programs pursued a strategy that is expedient, but probably inadequate. Since the 19th century, they have tried to convince industry's leaders that pollution control is in industry's financial self-interest. For instance, since the 19th century, smoke control advocates have argued that the particles in black smoke represented unburned coal, which was the result of inefficient combustion. They argued that better furnaces would burn more efficiently, save money, and produce less smoke, a win-win situation for everyone involved. They also argued that mills could save money and produce better yarns and fabrics if they switched from coal power to electricity. And those kinds of arguments, I think, are good arguments, and they can be effective in some cases. But it's a limited approach. There are going to be many other cases in which pollution control is not going to be in industry's financial self-interest. In those cases, it is necessary to generate the political will that is required to impose regulations on industry that will benefit the public and public health, and it has often been difficult to motivate that kind of political will. And another problem is that health officials and other advocates have long tried to inspire reform by highlighting the health costs of pollution. Physicians condemned the health effects of smoke since the 19th century, blaming it for tuberculosis, for plague, for respiratory diseases, and now many people have realized that the most serious consequence of air pollution is an increase in heart disease and heart attacks. Newspapers now routinely explain that air pollution in Delhi is the equivalent of smoking 2 packs of cigarettes a day. And people will say whether or not that's actually a fair comparison, but you'll see that kind of claim circulating widely. And again, many of these health concerns are legitimate concerns. Air pollution is bad for health. Yet the residents of Indian cities have not yet demanded that governments intervene to protect their health, or they haven't yet convinced governments to intervene to protect their health. And again, for a century, health advocates have often drawn a contrast to water, saying that people would not be willing to drink foul water. And as a result, cities have eventually imposed systems to try to provide clean drinking water to their population, or at least most of their population. But even though people are not willing to drink foul water, they are resigned to breathing foul air. And in fact, they almost never have any choice at all. Now, I don't understand why it is that people have been less tolerant of polluted water than they are of polluted air, but it is certainly the case that advocates of clean air have not yet figured out how to use the toxic effects of smoke and air pollution to demand new laws and policies that would prevent smoke and other forms of pollution. Now, this history presents a historian, and really all of us, with a basic question. How can we use this knowledge of history to motivate the reforms needed today? When we appreciate how long Indian cities have been dealing with air pollution, we realize that there must be deep obstacles to reform. When we recognize the ways in which air pollution has changed over time, we understand the complexity of the problem and the need for multifaceted strategies. And when we see that the common arguments, appeals to industry self-interest, or calls to control smoke to improve health. When we see that these have not been persuasive, we realize that we need new and more compelling strategies. Air pollution has been controlled in many parts of the world. Air quality is much better in the United States now than it was 50 years ago. Air quality is much better in eastern China than it was 15 years ago. The challenge is figuring out strategies that will work for India. So let me turn it over to my colleagues now, who will each share some thoughts. We will then have time for a discussion and open the floor for questions. So let me stop sharing, and then I can provide the first introduction. So the first speaker, Sunil Amrith, is the Renu and Anand Dhawan Professor of History and the Henry R. Luce Director of the Whitney and Betty McMillan Center at Yale University, where he also serves as Vice Provost for International Affairs. His research explores the interconnections between migration, environment, and history across South and Southeast Asia and the Indian Ocean. A MacArthur Fellow and recipient of the Toynbee, Heineken, and Infosys Prizes, his acclaimed works include The Burning Earth and Unruly Waters. His current work examines migration and climate change, continuing his explorations of how human health and ecological histories intertwine across the global South. Sunil.
Thank you so much, David, and thanks to the Mitchell Institute for having me back. I was a member long ago. It's really great to be here and in conversation with David and Bhargav, and we've been talking for about a decade, actually, about some of these questions, and it's nice to resume that conversation. What I'd like to do is just reflect on what David was saying in the broader context of the longer history of collective action for environmental protection in India, reflecting on really where air quality fits within that wider picture of environmental action. And I'd like to start with the paradox of visibility. Air pollution is viscerally visible with every breath. And yet, of course, the paradox is that it has been very intermittently visible on the policy and political agenda. And in fact, it almost becomes more visible in its absence. I think you'll all recall those few months during the COVID lockdowns where suddenly there were a lot of news articles about how suddenly the Himalayas were visible from Delhi. And it was really almost only when the air pollution vanished that it became visible, so to speak. And in some ways, I think this is a counterintuitive in global historical perspective, because in other times and places, whether that's 2000s China or 19th century England, air pollution has been the wedge that has opened the way to broader environmental action precisely because its effects are so easily felt. That's not been true in India. And to understand why, I think we need to look at what has motivated environmental consciousness and action in South Asia and to reflect a little bit about where air quality might fit within that story. So, broadly speaking, there are two main forms, I think, of environmentalism in India that we see since the 1960s and 70s. One is an outward facing international argument about historical injustice and inequality. And this was the heart of Indira Gandhi's famous speech in 1972 at the first UN Conference on the Environment in Stockholm. And she was the only head of state to attend apart from the host. And that was an early articulation of what we might now think of as an argument for environmental justice. And Indira Gandhi said, we didn't cause this problem. In fact, the wealthy, advanced countries of the world, this is in the early 1970s, have got ahead by exploiting the resources of the earth and the resources of others. Now we are being told that we need to slow down our own efforts at development. And of course, the argument is that those who've historically benefited from polluting the commons, polluting the earth, need to bear the cost. And of course, this is a familiar argument that has been stated again and again, and we hear it every time COP meets. Going back to David's early slides about the history of air pollution in 19th century India, in a way, Indira Gandhi's argument was that there wasn't enough pollution in India in the late 19th and early 20th centuries. The argument was that colonialism had held back India's industrialization, and therefore that in the last quarter of the 20th century, that industrialization needed to accelerate to compensate for historical harms. A more pointed version of this argument was made in a 1991 pamphlet by Delhi's Center for Science and the Environment called Global Warming in an Unequal World. And the opening sentence, I think, says it all. Sunitha Narayan and Anil Agarwal wrote, the idea that developing countries like India and China must share the blame for heating up the earth and destabilizing its climate is an excellent example of environmental colonialism. And today, this argument actually takes the language of carbon space. One often hears Jaishankar and other Indian policymakers use the language of carbon space. And this has both a spatial and a temporal dimension. At one level, it seeks to stake a sovereign national claim to what is invisible and boundless, which is the distribution of greenhouse gases in the atmosphere. In that sense, it's akin to the 20th century division of the sky into nationally bounded airspace. But there's also historical claim. I've multiple occasions one hears Jaishankar say those who have occupied carbon space have the responsibility now to redress that. And so, in some ways, air pollution is written off as a necessary part of catching up. Within that entire tradition of argument, going back to the 1970s to this moment, the right to carbon space is effectively the right to emit. And this is underpinned by a restatement of an older idea that prosperity must come first and then the capacity to clean up. So this is back to David's second point about proliferating new sources of pollution. Well, those sources of pollution proliferate in pursuit of a developmental project which has very, very widespread social and political support still. So that's one. That's an outward-facing environmentalism, which India has been particularly, I think, eloquent and creative at broadcasting since the 1970s. The second strand of environmental action in India has been very different. It's been very local, and it has been anchored in local attachments to land and place. This has deep roots, what we might call, Ram Guha calls this the environmentalism of the poor. It often begins as a quest for land rights. Movements across India in the 1970s and 1980s expressed themselves in the language of care for the soils, for the forests, for the rivers. Again, air has not featured prominently in those social movements. We can speculate about why. Air is unbounded, evidently more than local. It lacks the tangible connection with livelihoods that has been so important to, for example, the defense of forest rights by Adivasi communities. There's also the question of historical sequence. If we look at the most emissions-intensive pockets of extractive industry in India, for example, in the Chota Nagpur region, these were founded upon a process of land acquisition that had to take place first before the air pollution could begin, and it was often that original dispossession that has lingered as the perceived cause of injustice. So it's about land more than it's about the air. Now, India's outward-facing discourse on environmental justice and diverse internal articulations of environmentalism, I think, have both found air difficult to incorporate. By definition, it's more than local, it's not quite national either. Neither is it easy to point to particular legislation like the Land Acquisition Acts that are clearly identifiable as a source of injustice. Yet this brings us back to one of David's slides, because in theory, action on air pollution can bring about a more expansive sense of membership, of who is the we. Well, we all breathe the same air, so we ought to find common cause, common interest in struggling against this, but those coalitions have been very intermittent. And there too, as David mentioned, in relation to crop burning, for example, questions of jurisdiction don't go away. This brings me to a broader point, which is that demands for environmental action, environmental justice in India have always and continue to be demands that are primarily made of and upon the state. I'm struck by a comment that the scholar and activist Surupa Mukherjee makes when reflecting on her experience of interviewing victims of the Bhopal gas disaster in 1984. And one of the questions she asks her interviewees is, who do you blame for this? Is it the government or the company? And this is what Mukherjee writes. The majority of women said with unflinching clarity that they blamed the government because their own nation had betrayed them. In no uncertain terms, it was a denial of rights that they were entitled to. And so this raises a further conceptual difficulty, which has to do with the greater difficulty of imagining the relationship between the government and the air, compared with the relationship between the state and the land, which is marked everywhere with signs of the state's presence and codified in law. And yet we do see some sense of how battles over jurisdiction, for example, the blame game between Delhi and Haryana, or indeed between India and Pakistan, when it comes to who's responsible for the winter spikes in air pollution, now reach into the air as well. And here perhaps there's an interesting precedent in Southeast Asia, which I think has gone much further in experimenting with the governance of transboundary haze, in that case caused primarily by Indonesian forest fires, but there have been frameworks in place since the late 1990s. Mixed success. So, building coalitions to push for action on air quality, I think we need to pay attention to how success has been achieved in other realms or what mobilizes people, how important it is to create tangible ways of linking the difficulties people have breathing with questions of responsibility for those conditions, and in turn with specific policies that will ameliorate the situation. Thanks very much.
Excellent. Thank you for those wonderful remarks. I look forward to this discussion. But first, I'll give our chance to hear from our second speaker. Bhargav Krishna is the convener of the Sustainable Futures Collaborative and coordinator of its environmental governance and policy vertical. His work focuses on the health impacts of air quality and climate change, spanning health and environmental policy. Previously, he was a fellow at the Center for Policy Research and founded the Center for Environmental Health at the Public Health Foundation of India, advising governments on air pollution and waste management. He holds a doctorate in public health from Harvard University, a master's from King's College in London, and a biotechnology degree from Anna University, and he is adjunct faculty at Public Health Foundation of India. Bhargav.
Thank you so much, David, and wonderful remarks. And I following behind both of you is going to be quite a challenge. But thank you again to the Mittal Institute for hosting this as well. Let me just share my slides. So I'll try to sort of bring us back to the present a little bit, if I can. I think we've heard a little bit about the development of the conversation around air pollution over the last couple of centuries, really, around India and what that's entailed. And how those conversations have developed through links to the health impacts that have been studied quite widely in this country as well since the early to mid 50s. Just to give some context to those who may not know, air pollution is a year-round and nationwide problem around the country. On the right, you see population-weighted PM 2.5 exposure across different parts of India, and the standout here, of course, is the fact that the Indo-Gangetic Plain is the most polluted region in the country, where PM 2.5 exposures often exceed 5 to 20 times what the World Health Organization considers acceptable. A recent study noted that 82% of Indians are exposed to PM 2.5 levels that are much higher than what even India's more relaxed air quality standards consider acceptable. If you use the WHO guideline, that's closer to 97, 98%. The State of the Global Air notes 2.1 million deaths a year attributable to air pollution, primarily from non-communicable diseases. And the challenge in India is a little bit more unique, given all of the context that David has provided. We have a plurality of sources, not just local, but regional. Transboundary air pollution is also a challenge, not just air pollution that flows into India, but India's impact also on countries that are around it. Nepal, Bangladesh, Bhutan, for instance. Effective regulation continues to be a challenge. And as a result of that, what we've seen over the last couple of decades is an increasing number of cities around the country that don't comply with our standards for clean air. And within all of this, the greatest focus has been on the national capital region of Delhi. In terms of health impacts, if we were to take a moment to contextualize what air pollution is with respect to all of the other traditional risk factors that we would view over the course of a person's life, air pollution is the number one risk factor for deaths in India, far higher than traditional risk factors like high blood pressure, poor diets, even tobacco smoking. And that continues to remain the status quo with respect to the health impacts, despite action that has been taken on a few sources, as I'll get into further down the slide. But the conversation seems stuck in what we view as a winter problem. And I think the seasonal peaks continue to drive the conversation around air pollution, as both Sunil and David have mentioned. And the fact that air pollution is absolutely visible because of the seasonal contribution of a couple of sources, including crop residue burning and firecracker use, means that the conversation only really starts to ramp up in October and November every year, when in fact the air quality in Delhi and much of northern India is actually quite poor throughout the whole of the year. Of course, the visibility of air pollution is worsened substantially by the fact that we are in a sort of enclosed geographical region, and meteorology aids in retaining the air pollution in this particular geographic zone of the Indo-Gangetic Plain throughout the course of the winter. And as a result of that, you have the Supreme Court and various other courts scheduling more regular hearings around the fact that air pollution is a problem, citizens filing public interest litigations, pushing the government, as Sunil mentioned, to take more immediate steps and show visible action on what is happening. But of course, what happens is, of course, as the air quality improves naturally by the fact that winter is subsiding, attention diminishes once again. And the cycle of seasonal attention has led to an almost excessive focus on showing activity in winter over what should be year-round, more thoughtful, planned action. Now, the public posture around air pollution has also been quite interesting, and how it has evolved over time, especially from the perspective of the government. And I think if we look at the sort of early years of when air pollution really started to gain public prominence, not just in India, but globally, the idea was essentially that it isn't really a problem. And I think the environmentalists and various others who are interested in this particular subject, including academics, are really overstating the fact that air pollution is a challenge. And that position evolved as we had more and more health evidence that was being generated locally, and an acknowledgement of the fact that it is a problem, but that Indians are somehow more unique in being able to handle air pollution because of their sustained exposure to it, and that it wouldn't be as harmful to Indians as it would elsewhere around the world, for that matter. And the more recent evolutions have been a belief that it's not necessarily just just a winter problem, and that there are only a few sources that are contributing to this. And you'll see this even in the way the media talks about this issue. If you were to watch television media over the course of winter in Delhi and in some parts of the country, you would assume that crop residue burning is literally the only source of air pollution that's contributing to our problem in North India. And an excessive focus on that has taken away from focus on other issues. And the most recent, of course, has been the idea that the air pollution levels are bad, and it's so bad that the only way we can really fix it is by implementing a series of wacky ideas. So it started with things like smog towers or outdoor air purification in the 2019-2018 time period, then graduated into things more recently that we've been seeing is trials for cloud seeding when conditions are largely unsuitable. Now, if we were to drill down into what actually contributes to air pollution across Delhi, but I think there are some commonalities across the rest of the country and most cities as well. I think we get a sense of what actually contributes here. So vehicular exhaust from petrol, diesel, and other sort of vehicular fuels contributes between 10 and 30%. And this is a summary from pretty much every study that's been conducted from the late 1990s to the early 2020s. Dust from construction and roads contributes between another 10 and 30%. Industrial sources, including power plants that are located near the city, contribute another 10 to 30%. And residential cooking and heating, especially in unorganized settlements. And in even organized settlements where people burn wood to keep warm in the winter, contributes around 10% in the summer and around 30% in the winter. And lastly, open waste burning, which is a persistent problem and reflective of poor management of solid waste around the city. Now, these sources that we've listed here are pretty common across most cities around the country. But the thing that we actually end up focusing on through the course of the policy actions that we're engaging in is the bottom three. So we view the fact that agricultural residue burning is a huge problem, even though annually it contributes to under 3% of our air pollution. Diwali firecrackers have been a fundamental source of public interest litigation. It contributes to under 1%, even though the peaks that it causes are substantially higher than what we would like to experience. And dust features quite prominently. The response to this over the last 2 decades has been characterized in roughly sort of three slightly overlapping generations of action. The first one, David touched on initially, which was sort of action driven by public interest litigation. An environmental lawyer filed the case with the Supreme Court in the mid-80s, MC Mehta, and that case continues to this day. It's never been closed. And under the sort of auspices of that particular case, several court-mandated actions have been taken, including the transition to compressed natural gas for buses and other public transport in Delhi, relocating brick kilns, which were all within the boundaries of the National Capital Territory, to outside of that boundary, the shutting down of industries and thermal power plants that were located within the city as well. Several illegal industrial units were shut down, and this was sort of in the late 90s, early 2000s. And the second generation of this was characterized by a Supreme Court appointed committee called the EDCA, which focused on a sort of sectoral cut with respect to what it wanted to tackle. And the three things that stood out to us, for instance, were the ban on particular polluting fuels. So, for instance, pet coke, which is a highly polluting fuel primarily used by small and medium industries, were banned in Delhi, and a deadline for transition from that fuel was set for December 23. The vehicular emissions norms, which were lagging behind compared to the rest of the world. Delhi was slated for leapfrogging those from a Euro 4 to a Euro 6 equivalent emission standard, and this was effected in a timely fashion. And of course, a substantial focus on electric vehicles and expanding the EV bus fleet and introducing new subsidies for personal electric vehicles. The most recent generation of action has been focused largely on cities and characterized by the National Clean Air Program, which launched in 2019, identified 131 cities around the country which were either non-compliant with the national ambient air quality standards or were home to over 1 million people. And over $1.3 billion was given out to these cities with a focus on reducing PM10 or dust concentrations in these cities, 30% by 2024, 40% by 2026. This program, of course, spurred on a lot of action, and we'll get into that in a little bit. This also brought with it, around this time period, we also had the seasonal peaks brought into focus. What are we really doing around winter? And so a new action plan called the Graded Response Action Plan was issued by the Central Pollution Control Board, which introduced a series of activities that needed to be undertaken by regulators based on levels of the air quality index. Subsequently, they also introduced a decision support system and a forecasting tool that would guide proactive action with respect to this, but really hasn't been put into practice in the same way. And I mentioned the silver bullets, of course. We've had a variety of them that have been tried and largely been unsuccessful after spending much taxpayer money in the process. So what's really stifling our progress? And I think touch on a couple of things that both Sunil and David mentioned. I think the political economy of air pollution is a problem. And I think if we're talking about the fact that air pollution is, if Indira Gandhi characterized it as, okay, this is something that is a necessary evil for us to develop rapidly, I think that it continues to be that kind of inconvenient problem, even in the India of 2025, because it is still a developing country. And it's considered an urban problem. It's not necessarily something that's pervasive across rural India, even though what we know from the data is that air pollution is as bad in rural India as it is in urban India. The health frame is largely missing from this conversation. I mean, as much as David says that we have not been able to make persuasive arguments around this issue, the understanding of health science is really lacking in environmental policymaking circles as well. We've had conversations with regulators, for instance, where the bar for what is considered acceptable evidence is set unreasonably high. Basically, you have to prove causality for individual deaths from air pollution, beyond which they're not really interested in hearing what else you're doing. And this is a byproduct of really epidemiological expertise being absent from these policymaking circles. If you look at how the US EPA decides air quality standards, for instance, you have a Clean Air Scientific Advisory Committee that's interdisciplinary in nature. I don't know if it still exists at this point in time, but prior to that, at least the Clean Air Scientific Advisory Committee comprised biostatisticians, epidemiologists, atmospheric physicists, environmental engineers, various other disciplines that took an interdisciplinary view to the problem. And what we've seen as a result of this is also that practicality really is guided decision making, or expediency, if we want to be a little harsher. The choice of pollutant to regulate and enforce with respect to the National Clean Air Program, for instance, there was no adequate baseline for the majority of cities to measure progress on PM 2.5. So we switched over to PM 10. And with that change came a whole suite of actions that basically had nothing to do with protecting health. The least inconvenient of policy actions essentially ended up getting prioritized. And so if you drive around in Delhi in winter, you'll see lots of trucks going around spraying water on the road. You will see substantial action that is being taken on managing road dust. Maybe the most visible, but it's not necessarily the most toxic. We also have undercapacitated institutions, which are ill-equipped. They're poorly funded. Our state pollution control boards have vacancies of between 40 and 60% in key technical positions, and they haven't necessarily envisioned what their capacity needs to be to manage 21st century problems. So they're still functioning with the 20th century institutional design. And lastly, we touched on this as well, which is the question of accountability. And this has been exacerbated a little bit also by the fact that there is an excessive reliance on the Supreme Court and the National Green Tribunal to drive action from the government, because citizens don't necessarily see government as responsive to these particular concerns. And this is carried on for 3-4 decades now. And you've already mentioned the federal structure, of course, and the plurality of sources and the complexities of intersectoral action, which means that there is no single person accountable for air pollution at whichever level of governance you want to look at it. So, for instance, as of now, you have cities and urban local bodies essentially tasked with implementing the National Clean Air Program, who really have no power to do anything beside manage dust and manage waste. And then you have state governments and their state pollution control boards, which are tasked with managing transport emissions, state pollution control boards manage industrial emissions. And then there are various things that happen outside your administrative boundary, which you have no control over. So there is no coordinated action across any of these layers of governance that facilitates effective progress. So where are we now? I mean, we painted a dire picture, but I think there have been a few things that have changed over the last 5 to 7 years. I think there's substantially increased awareness around air quality. People are much more aware of what they should and shouldn't do in winter, what the health harms look like. We have a much more expanded policy space. Cities are much more concerned about air quality and are looking to address some of these issues. We have 3 or 4 times the number of monitors we had even a couple of years ago. We have regular monitoring in areas where we'd never had data before at all. And you have things like low-cost sensors that have been proliferating at scale, which cover a lot of peri-urban rural India and identify hotspots in urban areas. We also have the creation of new institutions. We have India's first representative airshed level air quality management institution in the Commission for Air Quality Management for the National Capital Region, tasked with managing the air quality across multiple states. And there's been substantial funding, of course, committed. Where do we focus our collective attention now that all of this has happened? And there are a few inflection points and opportunities that I think exist. The first is that NCAP 1, the current phase of NCAP, comes to an end in 2026, and there's a real opportunity to rewrite how we want to do air quality management in India going forward. We have followed a fairly traditional playbook with respect to how air quality is managed, mimicking perhaps how other developed countries have done it. But I think the situation in India, as much as we would like to think that we are unique, in this case, it is actually true to an extent. The diversity of sources doesn't really exist in many other countries. And it requires a different way of prioritizing and taking action that integrates the health frame in that conversation. The evidence base is only continuing to grow, but I think there is an opportunity to do more thoughtful, novel work around the impact of policy initiatives, so accountability research. And lastly, I think this particular winter has been a sort of crescendo of this, where there have been public protests, essentially organically driven, citizen organized, calling for action with greater investment and clearer lines of accountability. I think this increased public salience can only enhance accountability going forward. But I think to touch on a couple of points that David and Sunil also made earlier, the idea that air pollution and development are inherently distinct, or developmental goals for the country that include not just economic growth, but broader social development are not linked to each other is just false. And I think that's the dichotomy that we need to break. It's important that we recognize that air pollution is deeply intertwined with what developmental goals we have to make. If we look at the health impacts and essentially growing a generation of young Indians who are constantly exposed to high levels of air pollution, you're not only going to have increased health costs, you have the economic costs associated with that, and you have the productivity costs associated with that going down the road. And if we don't shift our thinking away from this sort of 70s mindset of development at all costs, absent any concern for the environment, then I think we're going to continue with this same trajectory.
Excellent, Bhargav. Thank you so much for that review and that mix of pessimism, but also action points that we can take going forward. We do have a couple questions from the audience, but first I want to ask one question for each of you. Sunil, you've also written a lot about water. And again, I want to go back to the question about why has water control seemingly been more successful so far than air? Visibility is an interesting aspect of this, but even with air, the sensory aspects are broader than visibility. If you look at the complaints that people have had going back to the 19th century, they would complain not just about the visible effects of air pollution, but the smells, the taste, the feel. It would get into their food, it would get under their clothes, the grittiness. So air pollution has been a very multi-sensory toxic influence for people. And yet something about air doesn't have the same effect that water has had. And given what you've written about water and water policy, do you think there's something we can learn from the history of water regulations that could somehow be useful for air?
I think we should begin with the question, has water regulation been more effective? very patchily so. I mean, I think, yeah, I think if you take the overall trend line of accessibility of clean drinking water, yeah, it looks better than the air pollution story that we've been telling, but there are still huge gaps. There is still the possibility of reversal if you look at water pollution, if you look at river pollution. It's not necessarily a dramatically better story than what we're thinking about with air quality. In fact, Diana Eck, the current director of the Mittel Institute, wrote about 10 years ago, a really interesting book musing on this paradox that, India's rivers are both so sacred and so polluted. I'm not sure we've moved all that far. Again, localized successes, no question about it. I think you're right that maybe big picture there has been more progress towards clean water availability than air, but I think in the institutional context that that Bhargav in particular laid out, there's a lot of intersection, I think, between air and water, and I'm not sure that they're that distinct.
And then just thinking about you mentioned the Diana's X work on the sacred and the pollution. Is there any parallel in the cases of air there? For instance, one of the things that European outsiders complained about was various religious practices in India that led to air pollution. For instance, practices of cremation were a major anxiety in various times. Uh, that showed up again during COVID when there were fires from the huge burning yards. Uh, does air play as big a role in the sacred as water does?
I think others in the audience may be more expert than me. I would say not so central. I mean, I think there is something very specific about the place of rivers spiritually, in terms of cosmology. Which is not to say that there isn't very interesting commentary on the air in South Asian epic literature. A lot of that has to do with the monsoon, though. It has to do with air circulation more than air pollution, certainly. It has to do with the winds. It has to do with rainfall. It has to do with that, what we think of as the water cycle in modern scientific terms. That's present. I mean, it's present in Sangam Tamil literature. It's present in multiple different traditions, but I don't think it's as manifest in everyday life as the idea that the Ganga is sacred, for example.
And then Barbara, picking up on where you finished and the various kinds of action plans. So suppose you put on your most optimistic hat and you imagine 10 or 15 or 20 years from now having a conversation, and suppose it's the case that India does what China has done, which is, bring about improvements in air pollution over a 10 or 15 year time frame. What do you think would be most likely to have contributed? What could most make a difference? Again, in your most optimistic visions going forward.
Wow. Okay, I think there is a part of this which is it's not that we don't know what to do, it's just that we're not doing it very well. And I think the key to a lot of this is just enforcing things that we already know that need to be done well, whether it be industrial emissions, which we're dealing with an undercapacity state, that's managing that issue, construction dust, road dust, even things like crop residue burning. I think the solutions are all there. It's not that we don't know what to do. I think the challenge has been finding money and throwing it at the right solutions. And I think that problem has persisted. I think the tendency to veer towards quick fixes rather than addressing the structural concerns around air pollution has always been the Achilles heel. And if a government were today to decide to invest in building capacity internally to be able to address this challenge going forward, I think you'll see results in 5 years. The challenge is that you're still dealing with a 20th century architecture that's managing a ever increasing problem. I mean, even in the regulatory work that we've done, for instance, I think for one of the states that we looked at with respect to industrial emissions, they haven't hired anybody new in 20 years. In another state, when we were doing this evaluation of how much time does a regulator have to actually process a consent application from an industry, given the number of people who are working there and the number of consents that are processed every year. Effectively, an engineer in a state has to visit a location, carry out the monitoring, confirm the lab results, write up a report, and issue the consent has between 1 and 3 days to do so in most states, which is just virtually impossible. So it's just not happening. The technology is already available to be able to automate a lot of this stuff, and we're not implementing it effectively. So the positive thing is there are lots of things that we already know that we can do, and there are things that we can learn from elsewhere that we can implement fairly straightforwardly. That's the highly optimistic worldview with respect to this.
And I think, in that parallels, I think what happened a century ago, the fact that you had such dramatic reductions in air pollution with the start of the smoke nuisance commissions in Bombay and Calcutta suggests that industries in both cities had a list of tasks that they knew that they could do that would reduce their smoke emissions. And they simply waited to implement them until there was a serious regulatory threat. And once they realized that the rules had changed and it'd be easier for the cities to bring legal action against them, they almost immediately activated these policies. Uh, so I've been keeping an eye on the Q&A, and there are a whole series of interesting questions. I'm not sure if we'll have time to get to all of these. But the first one was to Sunil about this question of air pollution activism being uncoupled from the land struggles that shaped it into his environmental history. I wonder if you could say more about that.
Um, this is Karthikeya's question, which I thought was so insightful. I mean, this is really interesting. I don't know if you can all see it, but the question has to do with how we what the difference is between here it is. Whether other diffuse ambient hazards, mosquito-borne diseases, stray animals, which also define the everyday ecology of a city like Delhi, offer a different lens on how the state manages environmental risk. Do you see this as part of the same story? I think you've made a really insightful connection there. I hadn't quite seen it that way. It's interesting for me because, in fact, my very, very original way into all of these interests was through my earliest work on disease control in India in the 1940s and 50s, thinking about malaria eradication. And in fact, if you look at those documents from Ministry of Public Health and from the WHO in the 50s and 60s, they're constantly complaining that administrative structures are not well suited to the scale of the problem of vector-borne disease. And so it's a very interesting question to kind of bring back to me, they are part of the same question. And that question, if I may put it in a sort of more abstract way, is how far can environmental hazards be spatially constrained? How much insulation is possible? So the question with air pollution is, can those with resources insulate themselves with domestic air purifiers and shutting the windows? Or does there come a point where that is just not possible anymore? And I think the same thing is true with vector-borne diseases and with stray animals. Is this a problem that is confined to certain parts of the city where the poor and the marginalized live, or are these problems that then start to impinge on the lives of the elite? And I think that if you were to take that angle, that would be a really interesting way of bringing together. And I like this idea of ambient hazards, which includes not just air pollution and air quality, but also other forms of life that imperil human health. So thank you very much for that question and really for that insight.
Bhargav, the next question is about some of the concrete things that could be done, whether about reducing steps that could be used to mitigate the air pollution that's coming from crop burning. But they ask specifically, are there devices that could be installed at the traffic signals or lampposts that can detect the pollution and contribute to cleaning the air quality? What do you see as the role for these kinds of micro technology interventions? Are they potentially useful, or are those likely to be investments on things that only make a small difference?
I think you kind of answered your own question there to an extent. I think the how do I put it? I think technology has an important role to play, but I think in a limited context. The technologies that we need to address this problem already exist. And the easiest, most straightforward way to do the work that we need to do to manage air pollution is control air pollution from the source, not suck it out of the air once it's already been released, right? So the smog towers that were installed in Delhi, huge cost, mandated by the Supreme Court, and we've seen very little impact. I mean, even within 50 meters of the smog tower, there was hardly a negligible difference in the air quality. And if you need to clean the air in Delhi using these smog towers, which are occupying like 20 square meters, you need to install 1 million of them. That's the scale we're talking about, right? And so there is really no scope of sucking things out of the air once it's already been put there. The only way to really manage this is to stop it from going there in the first place. With respect to crop residue management, I think there's been work done on managing residue once it's been produced. But I think the underlying reason for why this problem exists has largely remained unaddressed, which is that you're growing crops that are hugely water dependent in an area that is deeply water scarce. And the long-term solution to this problem is not to keep throwing machinery at farmers, but to really think about how do you transition away from growing crops in practices that are largely unsustainable. And it's not just an air pollution problem, it's a water scarcity problem. In fact, the reason why the crop residue burning problem exists is because of laws that were passed to manage water resources in the late 2000s. It's also a climate resilience problem because you're going to have significant impacts on agriculture if you don't grow more climate resilient crops. So this is all sort of deeply interlinked. It's also a financial problem because the continued supply of free electricity for pump sets and continued procurement of rice from particular parts of northern India is only contributing to a weakening of the exchequer. So the longer term solution has knock-on effects across multiple sectors. The shorter term thing only manages the problem in situ where you're dealing with it right now.
And another set of questions relate to this question of local action. You both talk about the potential, what NGOs have done in the past, what NGOs could do. And in some ways, the story of the campaign that took place around 1900 that led to the passage of the Smoke Nuisance Acts, I think the NGO in that case was the Times of India and the Indian media more broadly that was really hammering this issue, bringing attention to the problem. And that finally forced the governments to act. Obviously, there's local NGOs don't have the power to enforce the kind of regulation that Bhargav had said would be helpful. Uh, Political activism in India or any other country can be complicated. It depends on the receptiveness of the leaders who are in charge. Just a minute each. Do you see that there's much potential for community-based action to make a difference here?
I think community-based action is indispensable. I mean, as Bhargav concluded, you have these spontaneous citizen protests. Without them, nothing changes. The problem is that in and of themselves, they're not enough. Given the scales of the problems that we've been talking about, there has to be concerted state action. I mean, ultimately, I don't think there's any substitute for that. But as an spark, as a way of mobilizing people, as a way of mobilizing consciousness, I think, local action, even hyper-local action, has always had a place to play. And any success there has ever been, whether it's in environmental questions or in questions of rights, it has usually started with some sort of collective action. And I think that will remain the case.
Bhargav?
I fully concur. I think we are living in the era of government by discord. I mean, you have entire countries where people are elected and put into office through votes on Discord servers, and this is the context within which we're functioning right now. I mean, these particular protests in Delhi this year arose from people posting about it on Reddit and then creating a subreddit for it, and then subsequently a Discord server and organizing sort of talking points, placing people in sort of positions, organizing the protest event itself. And that's never had really happened before. It's been led by civil society previously. And I think there is perhaps an apprehension to civil society engaging directly on some of these issues, but citizens directly organizing on these issues is kind of unprecedented for at least the air pollution problem so far.
And certainly, if you were going to look at the history of the United States, as I said, the air here is dramatically cleaner than it was 50 years ago. What was it that happened in the 1960s that finally got the U.S. Congress to take serious action? It was that kind of citizen activism, launched by certain folks like Rachel Carson and her writing about this. But there was really a groundswell of environmental activism, the demands that led to Earth Day, the demands that led to that first UN summit in 1972 that Sunil had mentioned. Those were all responses to citizen action. Now, Bhargav also hinted that you can't necessarily take progress for granted. There is a risk of backsliding. The situation in the U.S., there's certainly been backsliding of the government commitment to this and the regulatory apparatus. Will that actually lead to air pollution getting worse? That's a longer time frame phenomena, and people are trying to watch carefully. And so even if once a success is achieved, it's essential that people continue to hold the leaders responsible and accountable if we're going to maintain this. So again, I'd like to thank you all for your attention over this hour. Obviously, there's an enormous amount of work that could be done, that needs to be done in India. And also, this is not just a problem that's unique to India. Air pollution is something that people are struggling with around the world. And it's part of a much broader problem of climate change. And so we are really going to need all hands-on approaches to try to figure out what we can do to ensure that we have the environments we need for health and safety going forward. So thank you very much, and I hope you enjoy your evenings.